One of these may not be drug-induced disease.
Malaria.
Okay, so answer to question 1, malaria. Question 2, detection of cancer does not involve the use of
C.
Biopsy.
Glucometer test.
Yeah, the answer is glucometer test. What's glucometer test used for?
For
Diabetes.
diabetes.
Yeah, it's for checking glucose level, rapid diagnosis of blood glucose. Therapeutic options in malignant conditions may include which of the following? A, surgery. B, ionizing radiation. C, chemotherapy. D, all of the above.
All of the above.
Yeah, all of the above. All of. What is a malignant condition? Yeah. Internet is
Like cancer.
this afternoon. Yeah, cancer. Which of this is not an anti-leukemic drug? Which of these is not an anti-leukemic drug? I think it can be used. So let's go for vasopressin. Okay, question 5. What common cancer in males may not include
Breast cancer.
yes. So drug used in the treatment of iron deficiency anemia does not include A, oral ferrous sulfate, B, protamine zinc insulin, C, parenteral iron dextran, D, oral ferrous gluconate.
Protamine zinc insulin.
Yeah, protamine zinc insulin. So what's protamine zinc insulin used for? What's protamine zinc insulin used for?
For diabetes.
Yeah, for diabetes. What type of diabetes?
Type 1.
Type 1. Yeah, type 1. Very good. Family planning contraceptive does not include
Andrew liver salt.
Andrew liver salt. C. Option is C. What is Andrew liver salt used for?
Constipation.
Constipation. Very good. It contains magnesium salt. Which of these is a parenteral progestogen only contraceptive? Parenteral progestogen only contraceptive. Anybody?
Depo. B.
Yeah, Depo Provera. Okay, which of these? Sorry, the ọ̀tọ̀ ní nǹkan tí mo lọ ń sáko Depo B for hate. Okay. How can patients make drug therapy to go wrong? A, refusal to obtain or take medication. Low system resources may affect or they try closing. There's something on my screen and the thing is refusing to go. Okay, yeah, it has gone now. How can patient make drug therapy go wrong? Refusal to obtain or take by following prescribed instructions, by not missing prescribed dose, by taking only prescribed drugs.
A.
Very good. Our answer is A. Which of these drugs is not a bronchodilator?
Loratadine.
Loratadine.
What class does loratadine belong to?
Antihistamine.
Antihistamine. What generation of antihistamine? First or second?
Second.
Second generation. What type of antihistamines are in the second generation? What type of antihistamine are in the second generation?
Non-sedative.
Yeah, non-sedative. Very good. One of the following is not a cough preparation.
Solvent.
Atrovent. Very good. Which of this is not an antacid? Yeah, the same pattern in this question 12. Malox, Gestid, Gaviscon, Buscopan.
Buscopan.
Buscopan, yeah. What is Buscopan used for?
Menstruation.
Eh? Okay.
Menstruation.
Antispasmodic.
Ẹ̀yin lẹ ń lò fún menstrual pain. What's Buscopan used for?
For abdominal cramps.
Yeah,
For spasm of the leg.
antispasmodic. It is an antispasmodic. Which of these medicines is not an ulcer healing drug?
Loperamide.
Loperamide.
Yeah, what is loperamide used for? Diarrhea. Yes, I already read it. It's an anti-diarrhea. And what pharmacological class does it belong to? It's an opioid, a weak opioid. It's a weak opioid and is used for diarrhea. Acute diarrhea agent does not include question 14. Acute diarrhea agent. What?
Codeine phosphate.
Codeine is used as an anti-diarrhea because it causes constipation. Constipation is one of the side effects of codeine, so you can use it as an anti-diarrhea. The one that is not an anti-diarrhea here is AZA or hazard thiopurine. It's not an anti-diarrhea. Which of this is not a laxative? Bisacodyl, methylcellulose, senna, anusol. Anusol. That's the answer. You actually got the answer, but you kept quiet. Yes, they are also called purgative. Medicines used in the treatment of diabetes may not include one of the following.
Oxytocin.
Oxytocin. So what is oxytocin used for? What is oxytocin used for?
For uterine contraction.
Yeah, for uterine contraction. Excellent. So during childbirth, it can be administered to promote uterine contraction. Treatment of hypoglycemia does not involve the use of
Rosiglitazone.
rosiglitazone. Very good. That's C, option C. What class does rosiglitazone belong to? Okay, yesterday, last year, 2021. Thiazolidine yeah. Thiazolidine. We mentioned it yesterday. Which of the following is not a disease of the cardiovascular system? Angina, hypertension, hyperthyroidism, heart attack. Which of the following is not a disease of the cardiovascular system? Angina, hypertension, hyperthyroidism, heart attack.
Hyperthyroidism.
Hyperthyroidism. Yeah, hyperthyroidism is an endocrine disorder. So when there's hyperthyroidism, what do you use? We have mentioned the drugs in our previous tutorials too.
Carbimazole.
Carbimazole. We use antithyroid carbimazole. Drug used to increase the force of contraction of the myocardium include
Digoxin.
digoxin. That's what we use. Option A, digoxin. We use it for the ionotropic effect. Ionotropic effect means it can increase contraction. Okay. Common adverse effects from the use of NSAIDs are all except
Didi.
common adverse effects from the use of NSAIDs are all except
Bleeding.
bleeding is there now.
Yeah.
When you have ulcer, if you are not taking care of the ulcer, it is the bleeding that will kill the person. Don't you know ulcer is wound? And one of the complications of ulcer is bleeding, gastrointestinal bleeding. Okay. So, but adverse effect of NSAID cannot be headache because they are also used in treating headache. You know, ibuprofen, you can take it for headache and all that. So that's it. I hope all except one are NSAIDs. All except one are NSAIDs. A, naproxen. B, fentanyl. C, diclofenac. D, mefenamic acid.
Fentanyl.
Fentanyl. What class does fentanyl belong to?
Opioid analgesic.
Opioid analgesic. You are ready for national exam. Serotonin agonists are generally referred to as
Triptans.
yeah, correct. Triptans. Do you know that? Do you know another name for serotonin? Anybody? The neurotransmitter serotonin is also called 5. The devil is a liar. 5 hydroxy 5 tryptamine. An example of non-dihydropyridine calcium blocker is this is not supposed to be An example of non-dihydropyridine calcium blocker is verapamil, correct. You see, you're out. Verapamil. See, the ones that are dihydropyridine, we have dipine in their names. Like this one, there is dipine, there is dipine, there is dipine. So it's indicating that they are dihydropyridine. But verapamil is a non-dihydropyridine. So, but the non-dihydropyridine, we have verapamil and what? Who can remember the second one? Dithiazem. Verapamil, dithiazem are the non-dihydropyridines. Digoxin is used in the treatment of heart failure for this effect. A, inotropic. B, diuretic. C, fibrinolytic. D, analgesic. Digoxin is used in the treatment of heart failure for this effect. A, inotropic. B, diuretic. C, fibrinolytic. D, analgesic.
Inotropic.
Because I mentioned it today in class, inotropic effect. So that's it. Inotropic means it increases contractility, okay? Yeah. Common symptoms of a strep throat are all except strep throat. Just imagine when you have sore throat. Common symptoms of a strep throat are all except What's the answer? Just manage ourselves. Yeah, cough. That's the answer. Question 25 is C, cough. The antitussive effect of codeine has been replaced by
Dextromethorphan.
dextromethorphan. Codeine has been banned, so dextromethorphan. What is the generic drug suffix for the proton pump inhibitor? Olol, aziprazole,
Prazole.
prazole, C, prazole. Adverse effects of the adverse effect of treatment with insulin include all except question 28. Adverse effects of treatment with insulin include all except
Hypoglycemia.
hypoglycemia will happen with insulin now. Hypoglycemia will happen with insulin. The answer is ketoacidosis. Because ketoacidosis is as a result of diabetes. When the blood sugar is not controlled, you have ketoacidosis. Okay. But when it is controlled, you don't have ketoacidosis. Ketoacidosis is common in type 1 diabetes mellitus. So when you are treating it, you won't have ketoacidosis. Is it clear?
Yes, sir.
One of these drugs is used in the treatment of productive cough. That's wet cough. Wet cough is productive, dry is non-productive. So one of these drugs is used in the treatment of productive cough.
B.
Yeah, guaifenesin. B, because it is an expectorant. Classes of drugs used to lower respiratory diseases. Lower respiratory diseases.
Treat.
It's supposed to be treat, rather. Yeah. Used to treat respiratory diseases include all except anti-leukotrienes.
The question again, please.
Class of drugs used to treat lower respiratory diseases include all except A, beta agonist, B, cholinergic, C, corticosteroids, D, anti-leukotrienes. Am I right?
Yes.
We use
Yes, sir.
anticholinergic, ipratropium, not cholinergic. So the answer is cholinergic because ipratropium is used in treatment and is an anticholinergic. Ipratropium is an anticholinergic, not cholinergic. Okay. What is the nature of a drug idiosyncrasy? What is the nature of a drug idiosyncrasy?
A.
It is an abnormal response to medication. Yeah, that's it. I taught this one in introduction to AUM that I taught you guys.
Yes,
Okay,
sir.
is
Yes,
there.
sir.
Which thyroid hormone is the most biologically active? Which thyroid hormone is the most biologically active?
T3.
Triiodothyronine is the most biologically active in our option. All except one are used in the treatment of gigantism and acromegaly. All except one are used in the treatment of gigantism and acromegaly. A, octreotide. B, bromocriptine. C, cabergoline. D, somatropin. All except one are used in the treatment of gigantism and acromegaly. A, octreotide. B, bromocriptine. C, cabergoline. D, somatropin. What's our answer?
Somatropin. D.
Somatropin, yeah, D. You are right. And a growth hormone antagonist. So anytime you hear or you see rheotide, it's a growth hormone antagonist. While somatropin is a growth hormone itself. Okay, it's a growth hormone. So the answer to the question is D. Which is not a symptom of diabetes mellitus? A, porphyria, B, polydipsia, C, amyotrophy, D, enuresis. Which of the following diseases occur when the thyroid gland is overfunctioning?
Goiter.
Goiter. Yeah, good. Goiter has to do with the thyroid gland. So what is, when do we have Cushing syndrome? Which hormone? Which hormone? When do we have Cushing syndrome? When do we have acromegaly? When do we have Addison's disease?
Cushing syndrome occurs when the body produces more cortisol.
Continue. Acromegaly, nko? Acromegaly is growth hormone. The drug montelukast belongs to dash class. The drug montelukast belongs to dash class.
Leukotriene inhibitors.
Yeah, excellent. Leukotriene inhibitors, B. The drug liquid paraffin belongs to which class of laxative? What?
Emollient agent.
I thought someone is saying something.
Emollient
What?
agent.
Yeah, emollient agents. The collective name for all medications used to inhibit anxiety is A, hypnotics, B, anesthetics, B, C, anticonvulsants, C, anxiolytics, B, D, anxiolytics.
Anxiolytics.
Sedative. So our answer is anxiolytics. Asthma can be characterized by all these except
Nose bleeding.
nose bleeding. The following are beta selective drugs for asthma, except
Aminophylline.
aminophylline. Aminophylline. What class is aminophylline?
Methylxanthine.
Methyxanthines. The following are corticosteroids used in the management of asthma, except beclomethasone, bromelain, budesonide, triamcinolone. Bromelain. Antimicrobial agents can be used in the treatment of infectious disease, except
Antihypertensive.
antihypertensive. So targets for antimicrobial agents include all of these except
Beta adenoreceptor.
beta adenoreceptor cells. The following are bactericidal agents except gentamicin, nitrofurantoin, vancomycin, isoniazid. I hate question.
B.
Nitrofurantoin B. Yeah. The following are bacteriostatic agents except
B. Abi.
B is bacteriostatic.
Rifampicin then.
Okay, rifampicin. The following are beta-lactam acting penicillins except ampicillin, ticagrelin, ticagrelin, penicillin, ciprofloxacin.
Ciprofloxacin.
Yeah, what class is ciprofloxacin?
Fluoroquinolones.
Fluoroquinolones. All these are non-depolarizing blockers except
This girl should over my girl.
question 48. What's the answer?
A.
Our answer is suxamethonium. Suxamethonium. That's B. Suxamethonium. Diazepam is an example of muscular blocker. It is spasmolytic. I told you that it can also relax the muscle. When we treated the question we treated, the following are H2 receptor antagonists except
Omeprazole.
omeprazole. The following is an aggressive factor responsible for peptic ulceration. The answer is acid. A. Acid is responsible for peptic ulceration. Mucus protects the GIT. Bicarbonate secretion also protects the GIT. Blood flow is also protective. So acid is the aggressive factor responsible for peptic ulceration. Proton pump inhibitors include the following except proton pump inhibitors include ranitidine. Non-steroidal anti-inflammatory drugs are drugs of choice for treatment of acid peptic diseases. True, false,
False.
false. False. 53 is false. Question 54. Neuromuscular blockers do the following. So the answer is B, mimic acetylcholine. They mimic acetylcholine. One of the following is the main action of the biguanide.
A.
No. A is not correct.
B.
Are you are you guessing? They're moving from A to B to C to D. The ones that reduce the amount of carbohydrate absorbed by the intestines will be the alpha glucosidase inhibitors. The alpha glucosidase inhibitors. You know alpha glucosidase inhibitors.
Yes, sir.
Give me an example of alpha glucosidase inhibitor. So that's the next question. So, what?
Acarbose.
Yeah, acarbose. So
Acarbose.
that one inhibits the absorption of it inhibits the absorption. But for biguanide, what they do is that they no, B is not the answer. It's C. C is the answer. They improve the sensitivity of cells to insulin. That's the answer. C. Then to question 56.
Okay, sir.
What's the answer?
Acarbose.
Yeah, acarbose. That is a typical alpha glucosidase inhibitor. That was a typical alpha fructosidase inhibitor. Let's see. Then, which of these lifestyle modifications would you recommend to a patient with hypertension? Which of these lifestyle modifications would you recommend to a patient with hypertension?
See,
Reduction
reduction of
of weight, yeah, where applicable. Okay, so that's our answer for that. Okay, then question 58. Which is an anti-cancer drug used for hormone therapy?
tamoxifen.
Yeah, tamoxifen is an anti-cancer drug. A, used for hormone therapy. And what type of cancer is it usually used for?
Breast cancer.
Breast cancer, excellent. Yeah, breast cancer. 60. One of these is a permanent family planning method. One of these is a permanent.
See,
Uh, 60C hysterectomy. Another name for angiotensin receptor blockers is
Satan.
B. Statins. What are the common signs and symptoms of heart failure? What are the common signs and symptoms of heart failure? What's the answer? The answer is C. Fatigue, shortness of breath, edema. 63. What process brings a drug from the administration site into the bloodstream through the oral route?
Absorption.
Yeah, absorption. A. What is vitamin B1 mostly required for? What is vitamin B1 mostly required for? The answer is B. Converting sugars into energy. Converting sugars into energy. Individuals with a severe allergy to penicillin should receive all except. What's the answer to 65? B. Cefaclor. No, sorry. C. Oh, what am I saying, sir?
The question is not correct.
Yeah, the question is not correct. Okay, yeah. Because individuals with a severe allergy to penicillin should receive all, except they cannot
Not
receive
re-
amoxicillin. It should be,
should not receive all
Not
except
receive all except
okay, yeah. So, except what will now be the answer?
azithromycin.
Azithromycin, yeah. Because azithromycin is not a beta lactam. Which of the following is not a diuretic? Which of the following is not a diuretic? What's the answer? Which of the following is not a diuretic? Yes, what's the answer?
Pioglitazone.
Pioglitazone. It is a thiazolidinedione, an anti-diabetic. Overdose of warfarin can be treated by administering
Vitamin K.
vitamin K. We have answered this before. After administering a drug, the time when the body starts to respond to the medication is called
Onset of action.
B. Onset of action. What is the common side effect of diphenyldramine? What is the common side effect of diphenhydramine?
Drowsiness.
Drowsiness. In fact, that's why they now use it for sleep. It's in Champagne Night. If you know that drug, Champagne Night. Champagne Night contains paracetamol and diphenhydramine. And that's because diphenhydramine causes drowsiness. That means it can make you sleep. High levels of blood glucose precipitate the release of which of these hormones?
Pancreas.
Hormone, not organ.
Okay.
Hormones, not organs. High levels of blood glucose precipitate the release of which of these hormones?
Insulin.
Insulin, yeah. Insulin. Because it is insulin that, what is the function of insulin? What is the function of
Convert,
what?
convert glucose to energy.
Is that what insulin does? I don't think so. This is what insulin does. If this is your body cell, okay, and if this is your blood vessel, and in your blood vessel you have glucose, okay, what insulin does is that it ensures the movement of glucose into the body cells. That's what it does. It ensures that glucose moves from your blood vessels inside the body cell. Okay. Then it also ensures glycogenesis. Okay. It ensures the conversion of glucose into glycogen. Okay. So that's what it does.
Sir.
Any question? Someone has a question? Okay. 71. Synergism in antimicrobial combination results in
Increased pharmacologic effect.
increased pharmacologic effect. Which of these drug products is a typical example of synthetic products? Tab azithromycin, tab paracetamol, injection streptomycin, injection artemisinin.
Paracetamol.
Yeah, tab paracetamol. That's B. Okay. Which of the following is not in what?
DNA recombinant.
DNA recombinant. Recombinant D, correct. From which of these plants are drugs derived from? From which of these plant parts are drugs derived from?
All of the above.
All of the above. They can be derived from the bark, from the stem, from the roots, even from the leaves. Cardiotonic drug derived from the leaf of the digitalis plant is A. Rizepine, B. Quinine, C. Digitoxin, D.
Digitoxin.
Codeine. Digitoxin, C. That's the answer. You can also have digoxin. Okay. So pharmacologic active constituents of drugs from plants may include A. Alkaloids, B. Glycosides, C. Gums, D. All of the options. All of the options. They can be alkaloids, okay? They can be glycosides. Take for instance, for glycosides, we have digoxin, okay? For alkaloids, we have several alkaloids. Nicotine is an alkaloid. Okay. Nicotine, morphine, there are quite a number of them. All right, so all of the above is our answer. Pharmaceutical drug nomenclature may not include
Patent medicine.
patent medicine. D. We have chemical names. Non-proprietary names are also known as what?
Generic.
Generic.
Generic name.
Very good. Drugs are not classified according to A, chemical structures, B, mechanism of action, C, brand names, D, mode of action.
Brand name.
Yeah, brand names. We don't use brand names to categorize or classify drugs. Which of this is not a prescription-only medicine?
B.
Yeah, B, paracetamol. Paracetamol is an OTC medication. Okay. Generic name of a drug may not be referred to as
A. National non-proprietary name.
non-proprietary name. A. Which of these route of drug administration is most convenient in emergencies?
Avenue.
What?
Intravenous.
Intravenous. C. This is your AUM. You are going to smash it. The limitation of orally taking drug may include. The limitation of orally taking drug may include.
All of the options.
All of the options. Correct. All of the options. That's D. Which of these medicine causes or aggravates pre-existing gastritis and peptic ulcers?
Aspirin.
Aspirin, correct. Aspirin. Aspirin. Why is insulin given via subcutaneous injection rather than orally? Why is insulin given via subcutaneous injection rather than orally? Anybody?
B.
Reach bloodstream through lymphatic vessels? Nope. 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 It can be destroyed by digestive enzymes. It can be destroyed. 85. Which of these routes is the best way to deliver precise dose quickly and in controlled manner throughout the body?
Intravenous. B.
Intravenous. B. Intravenous route. Intravenous route. Drugs delivered via transdermal routes does include. The answer is all of the options. Okay. Can give nicotine through transdermal patch. Can give nitroglycerin through transdermal patch. All of the options. Then 87. Plasma concentration fluctuates during dosing intervals as a result of A. Concentration of drug. B. Four administrations, four simultaneous drug movement. C. Time of administration. D. Volume of drug taken. So what's the answer to 87?
B.
What's the answer to 87?
B.
Yeah, the answer is B. It is because of admin. Yeah, that's why plasma concentration fluctuates because of hardening. And what is hardening?
Attraction, distribution, metabolism, and
A pathologic condition that influences drug dosing regimen includes pathologic 89. A pathologic condition that influences drug dosing regimen includes
drug interaction.
no, it's cardiac disease. Pathology means disease. So you just look out for disease. That's what pathology means. The medical term pathology means disease. So it has to be a disease. When they say pathologic condition, it has to be a disease. Okay, so it's cardiac disease. Drug-drug interaction is not a disease. It's just a condition. Pathology is disease, while physiology is normal function. Okay. Processes by which drug cross cell membranes does not include processes by which drug, question 90. Processes by which drug cross cell membranes does not include. What's the answer?
D.
No. The answer is metabolic rate. Metabolic rate is not one of the transport mechanisms. We have done cell now in anatomy. The answer is metabolic rate. All these other ones, they are transport mechanisms, except for metabolic rate. This is a transport mechanism. This is a transport mechanism. Pinocytosis too is a transport mechanism. So the answer here is metabolic rate. All right. Which of these best describes the term medicine? Which of these best describes the term medicine? We have done this before, so what's the answer?
C.
Eh?
D.
So what's the difference between D and C? Is there really any difference? So let's keep it. Let's keep it. There's really no much difference as such. What can be pharmaceutically sick? Which of this is not a class of drugs that act on the GIT?
Diuretics.
Diuretics. So what part of the body does diuretics work?
Kidney.
In the kidney. Oh, yeah, yeah, one of these is not a class of the cardiovascular system drugs.
C.
Yeah.
Hypnotics, yeah. What system does hypnotic work on?
The CNS.
Yeah, CNS, yeah, good. Central nervous system. Respiratory system drugs may not include. Respiratory system drugs may not include
C.
beta blockers. Excellent. C, beta blockers. Drug effect is usually terminated by which of these processes? Because some metabolites are also active. Some drug metabolite may have effects, okay? But whereas some metabolite will just be excreted. So if we are to pick any option here, it will probably be excretion. That's the most likely. But the question in itself is ambiguous. Which of these is not an excretory organ for drugs?
C.
Skeletal
Organs.
organs. This 2019, ibi tá a rí dé leléyìí o.